Welcome back to the channel, it's Dr. Somji. Today we're going to be talking about a hot topic. What's the difference between medical grade skincare and high street skincare? Is there one that's better than the other? And is medical grade skincare actually worth the money? So I'm going to demystify it for you because like with anything, there's some ninja tactics in terms of marketing that big companies do to make you believe one is the other and one isn't. So we're going to demystify it and I'm going to tell you a few home truths and what to look for in your products to ensure that you're getting the right thing for your skin. What's the definition of medical grade skincare? So as a purist, my definition of medical grade skincare is one that I have to write a prescription for. So what's the most common one that I prescribe on a daily basis in the clinic? Well, it would be azelaic acid. I like azelaic acid for numerous things. There's a video on this channel me talking about why I love the product so much, why that ingredient is so good. And it's something that I find myself prescribing a lot. So I tend to prescribe at two different concentrations. One for 15%, which is known commercially as Finacea. So that's a prescription I have to write. And one at 20%, which is known as Skinneren. These are two prescriptions that are available for most pharmacies once I write out the prescription for the patient that they can use at home. And I find that you get great results using these prescriptive skincare. You compare that to high street stuff. So you've got Paula's Choice 10% azelaic acid, which is at a lower percentage. So I'm like, what's the point? And then you've also got Face Theory's 15%. So what's the difference? Because you might say, well, look, there's high street 15% and there's medical grade stuff at 15%. Why would I need to get the medical grade stuff when I can get it from the high street without a prescription? Well, if you look at the ingredients list, they're quite different. If you look at the ingredients list of Finacea, as you got up on screen, the active ingredients is azelaic acid at the top of the INCI list. So it's right there. When you look at Face Theory's one, there's other emollients, other humectants, water, aqua, all of that sort of stuff in that formulation that essentially azelaic acid is a lot lower down. So you might not have, there's a difference between different products. Finacea is almost like a gel-like preparation that's got good absorption levels into the skin and you're getting more active ingredients delivered where you need it most. Whilst the Face Theory's one kind of feels a little bit nicer. Let's say, I'm not going to say dilute, but there's other products that are higher up there and you'd worry about the efficacy of azelaic acid. So how much azelaic acid is in that formulation per gram of product? You know what you're getting with the Finacea, with the medical grade one. While the non-medical grade, the high street one, you might not actually be getting the full benefits of 15% azelaic acid. And also, where is that azelaic acid derived from? So there's many different forms of azelaic acid and many different derivatives that you can get. And actually that changes the efficacy of it as well. So with medical grade stuff, you know it's the purest ingredient. You also know that the delivery mechanism is much better and it's also standardized. The high street skincare, there's a little bit of smoke and mirrors because especially with the Face Theory product, they probably put a lot into it to be able to put 15% on the label. But is it a true 15%? That remains to be seen. So I think, you know, if I'm looking at this type of thing, if I'm looking at things like azelaic acid, if I'm looking at retinoids like adapalene, these I would always say are worth investing in terms of medical grade product because you're getting the pure ingredient and you're getting exactly what you're paying for and actually you're getting a better delivery mechanism as well. So that's the reason why I'll go for medical grade for those types of things. But as you know, on this channel, I recommend loads of high street stuff. So where would you go high street and you wouldn't go necessarily medical grade? Well, look, here's a brand that's, you guys probably know, this is what's termed a medical brand. It's not prescribed, but you can get it from most clinics at a higher price. It's Obagi. You've got these oil control pads. And this is a perfect example of something that you might say, well, you know what, I want to go and see my doctor, I want to see my dermatologist at the practice, and they've got Obagi, which most of them have. And you'll say, well, I want to spend good money on this, and this is an expensive product. I'd have to check online how much it is, but it's expensive. It's more expensive than high street stuff. So this is kind of like oil control pads that have got like salicylic acid and other active ingredients in there for, let's say, more acne prone skin. Well, what's the difference between that and ordinary salicylic acid mask, which is at a much cheaper price point. Well, the fact is that this is a little bit more harsher. So if you overuse this and you don't use this correctly under a doctor's instruction, you could damage your skin barrier very, very easily. And I've seen loads of patients get this product from people that really haven't assessed their skin and end up getting more problems because they damage the skin barrier, like breakouts. With the salicylic acid 2% mask, it's at a lower concentration, so you're very unlikely to damage your barrier unless you're using this, not using the instructions that are written on pack, and you're using it, overusing it. So you can use this product on pack daily and you can ruin your skin. With this, it's very difficult to ruin your skin. So stuff in the high street is at lower concentration, and that might be better for you if you've got sensitive skin types, because medical grade products might be too strong. Now, is this a medical grade product? I wouldn't say it is, but it's put in, people put it as a medical grade product. What is a medical grade product from Obagi is the Nuderm Obagi, which is prescribed, and I like it because they're active ingredients. You can prescribe tretinoin, which is one of the highest strength retinoids that you can get. You can prescribe hydroquinone for temporary periods of time for depigmentation. But the Zedo stuff is, actually, although you can only get it from clinics, it's not necessarily medical grade, because I don't need to write a prescription for this. My therapist in my clinic can give this to patients after analyzing the skin. So a lot of companies are developing these types of brands, and these brands are called cosmeceutical brands. So that sits in between medical skincare and high street skincare. So it's given by a medical professional. It's very strong, can damage your skin if not used correctly, but it's not prescribed. And that, people say, well, look, high street skincare is not getting me anywhere, but maybe I wanna actually get a little bit more of a result. And that's where you might sit in the cosmeceutical range. So look, I've confused things a little bit. I've added a third different thing, but I think you guys deserve to know what is true medical grade and what isn't. And just remember, medical grade is prescribed, high street skincare isn't prescribed, cosmeceuticals isn't prescribed, but can only be given by a medical professional. So look, let's talk about a few different things again. So what do you get from this cosmeceuticals range, which I think, can help? You've got this product, which is called Tebiskin Sod C, and then you've got Skin-Ceuticals, their Floratin CF, which is like a different version of their CE Ferulic, which is their bestseller. Now, this, I always talk about CE Ferulic for like vitamin C. I always think it's worth spending the money on a cosmeceuticals like Skin-Ceuticals, because they've done a lot in this formula to preserve the activity of vitamin C. As we know, vitamin C is a highly unstable compound, and it can become an oxidant very quickly, and it can become almost like damaging to the skin if you expose it to air too much. And this formulation is a very stable formulation. So you can get vitamin C from high street stuff, but it might not be good quality vitamin C. The ingredients, the raw materials might not be good. But with this, look, it's manufactured by L'Oreal. They've got high standards, and you know that it's good quality stuff. But that's quite expensive. That's like over £100. If you come to the clinic, you've got like artisan brands, which are like medical skincare brands like Tebiskin, which originate from Italy. And they actually put a lot into this, because this Sod C range has actually got 4 different capsules in there. And it's in powder form, and it's not mixed. So you actually freshly mix each vitamin C vial, and it's normally active for about 28 days. So you've got like, essentially under like 4 months worth in this pack. But you know that the vitamin C that you mix is fresh, and you can put it in the fridge. So these are the types of things that you can get from cosmeceutical range, is that you may even get products that are superior than other ones that you see on the high street. And this is a good example, because this vitamin C is pure vitamin C, and that's all it is. And you mix it yourself. So you click it, essentially the hyaluronic acid mixture, like almost to make it a serum, again mixes with the powder, you shake it, and you've got your own serum. So this is something that's pretty cool. And like I said, I think you need to be able to demystify between what is high street, what is medical grade and what is cosmeceutical grade. If it's me, I think that most people can get away with a decent cleanser on the high street, which is absolutely fine. So things like Cetaphil, that's not going to damage your skin. You can get it on the high street. It's tested by dermatologists. If you've got sensitive skin, this is not going to do any harm. If you've got sensitive skin and you've got acne-prone skin and you want to kind of improve that, you need to be using the right actives. And that's where you might want to visit your dermatologist for a prescription for something like azelaic acid at the right amount so you can get what you can get. Moisturizers, again, maybe you can go through the high street because moisturizers are touch and feel. They are essential to your skin, but haven't got actives in there. If you're gonna have actives like vitamin C, there are no prescription vitamin Cs that we can prescribe. But maybe you might want to go on a cosmeceuticals range because vitamin C is pretty important. Same things with things like retinols. This retinol from Obagi is a retinol skin brightener, but it's a good quality retinol. And if you're going to use your vitamin A, C, and E's, maybe you want to spend a little bit more money on it. So look, I don't think you should sit on the fence of medical grade to high street. I think you should pick and choose. And this is my advice. Cleansers, yeah, you can pretty go on the high street. Serums and actives, probably you want to do cosmeceutical range. So like a Dr. brand, for instance. Moisturizers, probably you can get away with things like Cetaphil and stuff for your skin barrier. I like those kind of products. SPF, well, actually, if you're kind of like prone to things like pigmentation, you're prone to a lot of sensitivity, maybe you might want to reach out to your skin specialist for like a cosmeceutical SPF that's going to sit well with your skin. And then in the nighttime, active ingredients like retinoids and things like that, I personally wouldn't go so much for high street stuff because having formulated my own skincare, there's different levels and grades of retinoids. So even retinols, there's so many different grades of it. You can get encapsulated retinol, etc. Sometimes the higher price point means that the actual complex of the retinol as well as the delivery mechanism is much better in those kind of like slightly higher price points. So as I always say, worth spending money on the vitamin C's and the retinols. Maybe you don't need to spend so much money on things like cleansers and moisturizers. And that's it. That's my verdict. So I hope I didn't complicate that too much, but let me know in the comments below about any brands or any products that you want me to comment about. We'll try and get back to you. Don't forget to click the link to subscribe as well as that bell button so you'll be the first to know when new videos come out.